If you're still dealing with knee pain, you'll want to sit tight for this one. Orthopedic surgeon Dr. Richard Driesnack is here with more treatment options for you. Welcome back.
Thank you.
So when you were here before, we've already talked about causes, arthritis possibly making your knee go bad, injury. We've also talked about some non-surgical options for treatment, over-the-counter pain medications, certain medical injections. But now, if none of those options have worked, what's the next thing you do?
Typically, the patients that see me are interested in a knee replacement of some type. So we start to talk about the surgical options and what the expectations and the possibilities are there.
And what are the expectations? What is surgery like? What do I need to be aware of?
For a knee replacement, the expectation is for pain relief, improved function, improved quality of life. And for different people, that means different things, but all people should look forward to an overall improvement in their quality of life.
What's the recovery process like?
Usually these days, due to anesthesia and pain management improvement steps, the hospital stay for knee replacement is usually 1 or 2 nights only.
Oh, not much.
Most people are able to go home the next day. And the recovery process is variable, as you might think. Usually physical therapy is necessary for 6 weeks, sometimes 8 weeks or longer. That's a 3 days a week process. But in the hospital, that is started the day of surgery. Therapy will get you up, standing and walking the day of surgery, and then...
So you're walking the day you get the surgery?
Yes.
Wow.
Yes. Progressively after that, just as each individual can tolerate. For healthy people, sometimes it's even possible to do the surgery as an outpatient as well.
Wow. So some people get total knee replacements and some people get partial knee replacements. What's the difference?
Well, the difference is that the knee joint is actually made up of 3 parts. So there's the main weight-bearing parts between the thigh bone and the leg bone. And there's an inside and an outside, a medial and a lateral of that. And then there's the kneecap joint as well. So of those 3 joints, the total knee replacement will resurface all of those joints. A partial knee replacement will just resurface one of those 3 compartments.
Okay.
The most common is the inner or the medial compartment of the knee.
And so do you do both knees at the same time? I would imagine that makes it very difficult to get around.
Yes. There are pros and cons to doing bilateral simultaneous knee replacements. The ideal patient is someone who is younger, in good health, no history of heart or lung problems, motivated, willing to work hard, and has symmetric knee arthritis. In other words, both knees are equally involved and equally painful.
Okay. And so if you just do one at a time, you have that 6-week sort of physical therapy recovery, but if you do both, I mean, are you ambulatory at all, or do you recommend a wheelchair? I mean, how do you get around with both knees have been worked on?
You might think that, but surprisingly, with bilateral knee replacements, the patients are, again, up the same day of surgery. And I've had probably half of my bilateral knees go home the next day, just like a single knee, and then the remaining on day 2. So it's really remarkable, and I think the pain management techniques are really the reason for this primarily.
That is remarkable. I love medical technology. Let's put up a screen and let folks know how they can get in touch with you if they'd like more information, and then remind them that you're going to come back next month and we're going to talk about custom knee replacement, so you can sort of design your own knee.
Custom knees are something that I've been doing for almost 3 years. It's an exciting concept to me, and there's some 3D printing involved there, some high-tech scanning ahead of time, and it is designed to recreate a knee that is very accurately the same as your natural knee.
Wow, we look forward to that. Dr. Richard Driesnack, thanks so much for being with us.
Thank you.